So, a very good evening to all our audience who is joined at this late hour. Welcome. I'm Dr. Nivedita from Team Medflix, and on behalf of Team Medflix, I welcome you all to today's session, which is on art of medical consultation, the keystone of clinical practice. For this, we have with us Dr. Krishna. He is the director and co-founder of Global Academy. And unfortunately, Dr. Srikanth couldn't be with us tonight, but he will be with us for our future sessions. Dr. Krishna is a general practitioner with a busy practice in the southeast region of England. He has also been the member of Royal College of General Practitioners since 2011 and is also the training faculty at the Brighton and Sussex Medical School. He is very passionate about teaching clinical communication and consultation skills using very innovative teaching techniques, which I'm sure you all will see in the coming up session. Also, raise your hands because we have an interactive session. There's a game in between, which we would really like if all of you all participate. So, when announced, please raise your hands and come on stage. And use a lot of emojis to express your opinion. I'm sure y'all are going to have a fun time in today's session. And over to you, Dr. Krishna.
Thank you, Nivedita. Thank you for the lovely introduction. Good evening, everyone. Welcome. And thank you for joining us. We are grateful for your time and commitment. We at Global Academy would like to take this opportunity to thank Team Medflix for their invitation to share the space on this amazing, innovative, and inspirational platform. Thank you, Dr. Rohan Desai, for starting up such a wonderful initiative. Thank you, Dr. Rucha, Dr. Nivedita, Sangeeta, Dr. Dhruti, Lakshay, Neha, Shubham, and Ritika. Wonderful teamwork. Let's hope this is the beginning of a new, exciting journey. We would like to do more sessions on this platform and reach out to wider audience and raise awareness about importance of clinical communication skills. The intention of this session is twofold. One, to have a dialogue with you. I repeat, to have a dialogue with you on medical consultation. Number two, to help you understand the educational, which are mainly clinical communication focused programs that we offer, so that we know what we are about and what we teach and what we focus on, so that you can keep joining these sessions and enhance your clinical competence. So that's the intention of this session, twofold. This is me. In addition to what Dr. Nivedita has said, I'm a listening intelligence practitioner and I'm a chair of International Listening Association Healthcare team. That's me. And this is Dr. Srikanth. He is a practicing endocrinologist and a passionate medical educator. He sends his apologies. Couple of lines about Global Academy. Dr. Srikanth and I have started Academy in 2015 with an aim to enhance healthcare communication. Our mission is to empower you in becoming effective communicator. We offer various structured, interactive, I might add, fun educational programs. Our vision is to make you globally competent and locally responsive. Globally competent and locally responsive clinicians. Against that background, let's take a dive into the topic, medical consultation. As the title says, the art of medical consultation, this is a keystone of clinical practice. Why keystone? Because whatever may be the specialty, we conduct several medical consultations every day. It is estimated that every clinician at least conducts 2 lakh medical consultations in their professional practice, in their professional career. That number, not surprisingly, is expected to be very high if you're working in a busy healthcare setting like India. So you may be performing more than 2 lakh medical consultations in your professional career. So why this session? Although it is widely performed clinical activity, it is notable that there is inter-college, inter-regional, and international variation in teaching and learning medical consultation. It is our considered view that every clinician should be given opportunities in learning this most important clinical activity. That's our intention, and that's one of the key intention behind this session. So what is medical consultation? Let's get that interaction going on. Is there anybody apart from Malika who wants to take a stab at these numbers? Do you want to fill in the numbers? So medical consultation is what kind of meeting is it? So put your answers in the chat function. I'll wait for a minute. So what type of meeting? In a psychologically what space in which clinician and patient work to establish a diagnosis and design the best management plan. So Ajay, well done. He says number 4 is together, close, well done, but you got the meaning. Interactive, okay, go on. Keep coming, Krishna Priya, interactive, well done, but what number is interactive? Is it number 4, number 1? Keep those answers coming. Confidential, well done. Yes, is a meeting in a psychologically confidential, and I'm looking for one more word. Well done, you're amazing. Keep those answers coming. Open, excellent. Sound, number 2. Okay, close. So this is what I was looking for. Medical consultation is a professional meeting. Yes, formal professional meeting. Well done, Shobha. In a psychologically safe and confidential space in which clinician and patient work collaboratively, yes, close together, to establish a diagnosis and design a best management plan. So for the purpose of this session, I would politely request you to put aside all the challenges you're facing in Indian healthcare system. I'm acutely aware that there are time constraints, there are significant work pressures, there is conflict between doctors and patients. So let's put them aside for now. Let's look at medical consultation. You will learn that by learning and enhancing your clinical competence, you might be able to address some of them. So for now, that's my polite request. So remember those keywords: professional, safe, confidential, and collaborative. Stages of medical consultation. This is a busy slide. However, I would like to simplify it by using a movie making analogy. Iona, assume that you are a producer. You got the script ready, or Dr. Nivedita, you got a script ready. You want to make a romantic movie. So what do? You get started with your pre-production work, which is you select your director, who then selects and finalizes the cast, schedule, budget, locations, and the screenplay. So the pre-production work gets ready. When the pre-production work is ready, the production work, the making movie, the shooting starts. This is where the director makes sure that movie is made within the budget. And hopefully, we want the movie to be done within the budget and within the schedule. So that's the production work. Lot of work happens in the production work. However, pre-production work is equally important for the production work to happen in time. After production work, there is post-production work like audio release, teasers, posters, and interviews by the star cast. Although there is a lot of focus on the production work. All stages are important for the success of movie. Similarly, there are 3 stages to medical consultation. Pre-consultation, where the work you do before the patient comes into the room. You go through the medical notes, you familiarize yourself with the chief complaints they're coming with, or the test they had before in the last consultation. So you familiarize yourself. You are getting ready to talk to the patient. You switch off your phone. If you carry bleeps in hospitals like in UK, you put aside the bleep. You get ready to be present. That's the pre-consultation phase. It takes between 30 seconds to a minute. So it doesn't last long, but very important. Then comes the consultation phase. This is the meat of the consultation, meat of the medical consultation, where most of the action happens. Patients narrate their problem, you examine, you diagnose, you design a management plan. In addition to that, you're listening to the patient, you are putting your clinical communication skills into action, you are establishing rapport and humane connections with the patient. Yes, this is a key stage of the medical consultation because this is where you are forming the diagnosis and designing the management plan. You're working with the patient. This lasts from 8 to 15 minutes. In India, you have less time. People say that they only have 3 to 5 minutes per patient. We hear that. It can be done effectively in whatever time you have. More on that in subsequent sessions. Post-consultation phase. What happens in the post-consultation phase? Patient goes away, he pays the bill, he books the follow-up appointment, he cashes in the prescription that you have given, and he starts taking your medication. In addition to that, what are you going to do? You may want to recover emotionally. So emotional recovery is very important between patient to patient. In addition to that, clear documentation in the notes is also important. So it happens after patient leaves the room. So to summarize, there are 3 stages: pre-consultation, consultation, and post-consultation. All 3 stages are very important for conducting accurate, effective, and efficient medical consultations. So they say people like clinicians in India may conduct up to 4 lakh medical consultations in their professional practice, twice the number when compared to Western world. This is a slide. We prepared this slide to highlight the numerous interconnected factors that are at play when you are consulting with patients. There are patient factors, clinician factors, technological factors, environmental factors. There are so many factors. We all bear these in mind when we are consulting with patients. Can you see how complex the clinical activity it is? Hence, the need for structured training into it. I request you to pay attention to the bottom line and think on it for a moment. Medical consultation equals 2 humans, 2 experts. Patient is as an expert in his problem. You're an expert in medical knowledge. 2 belief systems, 2 egos, 2 agendas. So it's a partnership. It's not I need to win attitude. It's let's work together in working out what's best for you. Okay, these are 2 styles of medical consultation: collaborative and authoritative. They sit at both ends of the spectrum. Both have a role to play. Both are important. The important question is how well we stay in the space between the 2 styles of consultation, how well we adapt the consultation to the person in front of you, to the context, and to the problem. So it's all about how we flexibly use these 2 styles of consultation. There is a lot of emphasis in medical training now for clinicians, for students to be collaborative. However, in a multicultural society or a country like India, there is a role for both styles of consultation. I, in my clinical practice, and Dr. Srikanth and my colleagues, we we use both elements from both of them. If we know that smoking is really harming the patient, we may put our authoritative cap on and might request the patient to really consider giving up smoking. So it's how you adapt the style to the person in front of you is what is important. Okay, now, so far we have covered what is medical consultation, why is it important, different styles of medical consultation. Now, I want to play a game with you to help you understand the different elements of the medical consultation and what can we do to make sure that we perform effective medical consultation. So Nivedita,
Yes. So
this
is where it becomes more interactive. Y'all can see the raise hand option on the right hand side of your panel. Please come up onto the stage. It's a very interactive game. We all have played it in India. It's I think it's bingo, if I'm not mistaken.
It's similar. I'll share the instructions.
It's very similar to bingo. So raise your hands and come on stage, turn on your audio video, and let's make the session more interactive.
Fantastic. So people, this is a tried and tested game. We play it. We've been playing this game in our medical schools for many years. Everybody loves it. It really helps people to understand the different elements of the medical consultation. This is designed for you. So make the best use of the game by participating. So this is the game. It's called medical consultation game. You can zoom in like you did before. We're going to play it in two parts. Part one, here are the instructions. Assume you are a patient for the next 10 minutes. You are a patient, you are unwell, you are thinking of consulting a doctor. So you are a patient, you are unwell, you're thinking of consulting a doctor. Of course, we want a doctor to be knowledgeable and expert in technical skills. Yes. In addition to that, what are 2 or 3 elements that you want from the doctor to whom you are thinking of consulting? What are one or you can select 1, 2, or 3 because I'm mindful of the time, depending on how many participate. So I say between 1 to 3 elements. For example, number 7 and 8 are very important for me. Why? Because it makes me feel reassured and satisfied. That's why when I'm consulting a doctor, in addition to knowledge and technical expertise, I want him to explore and address my concerns and to know me as a whole person, to ask more questions, to know me as a person as well as a patient. So what are those 2 or 3 things that are important for you? Put your numbers in the chat or come on to the stage. Me and you can have a dialogue. I would love that. And explain why you chose those 2 elements. That's instructions for part 1.
Y'all can also play through the comment section. So y'all can put in the numbers as I said.
Yes. Junior says 3 and 11. Wonderful, Junior. You can come on stage and have a chat with me about why you chose those 2 numbers, please, or write in the comments. Dara says number 11. Why number 11, Dara? You can come on the stage and talk to us, or place your comments in the comment section. Why? Also think of why you're choosing that. Because it's very important for part 2. The more you interact now, the part 2 becomes more relevant. Shobha, 3. If you can read out, Nivedita, some of the comments that you might see, if they have explained why.
So, Dr. Iona has said that 1 and she chose 1 and 5 since being the one to comply with the management. So it's important to be as much involved in the decision-making process as possible.
Yes. Excellent. Hold on to that. So please come on onto the stage. We are friendly people. Come on, let's have a chat. I can't bite you. I'm so far away, and this is virtual.
Yeah, y'all can make it more interactive by coming on stage. It's okay if y'all don't turn on your video. We'll just make do with the
Yes.
audio for tonight.
Yes.
So I think
I'm
Dr.
curious.
So I chose, in case y'all didn't hear it the first time, so I chose 3 and 13. So
Yes.
3, as a clinician myself, I have seen that as a doctor, we think that whatever we are saying, the patient is going to understand because those are tests, that is the management. So patient is going to understand. I have noticed like people will go out, like patients will go out, and then somebody related to them will come in and they'll be like, डॉक्टर इसमें एग्जैक्टली क्या होता है या इसमें क्या करना होता है सो आई हैव नोटिस दैट so I feel like that is important to let the
Yeah.
patient know that this is what we are doing and this is why we are doing it and
Yes.
how it will go, because some patients go to the investigation place and they're like, oh my god, this is happening to me, I don't want to do it. In case
Yes.
you have to allow them to know that what is happening, so you have to kind of ready them for what is waiting for them.
Exactly.
So that is why the 3rd and 13. Now, doctor who allows me to tell my complaints. This I have noticed so much that literally people like a doctor. I think William Osler said it. Tushar Shah sir had a lecture the other day and he mentioned this, that the patient is telling you his story, his complaints, everything. But an average doctor will interrupt them within 8 seconds. Like you're
Yeah.
not letting them complete. You have to let them finish. They are exactly telling you the diagnosis and what is happening to them.
Yeah.
So those are the
Yes.
2, along with your 2 options, which was 7 and 8, I think.
Yes.
So I
Yes.
would choose those for me. Yeah, I
Wonderful.
think that's what.
What wonderful insights. Amazing, family. Keep
Thank
them
you
coming.
so
We
much.
have somebody else on the stage. Nivedita, who is
Yes,
it?
hi, Dr. Annie. You can
Please
give
share
us
your
your.
insight.
I chose 3. Actually,
Yeah.
the doctor, he should explain the diagnosis to the patients. He should know
Yeah.
what has happened to him and how
Yes.
he is going to be treated.
Mm-hmm.
What is happening with him and what kind of treatment and management is to be given to him.
Yes. Very, very, very important. Very important to not only explain the diagnosis, but give instructions in such a way that patients find it very easy to implement the management plan. Okay.
Yeah, exactly.
So that reminds me of is somebody else? VD, please share your insights.
Yeah, and he should be involved in the decision making also, number 5.
Yes.
Yeah, exactly.
Yes. So involve, like we said, isn't it? It's a collaborative effort. So make sure that patient is making an informed choice or making the decisions for him. Well done. Very beautiful. See, people keep sharing them. You're wonderful. We have somebody else.
Yes, that is Dr. Vijay Kumar. You can share your insights. What were your numbers that you picked?
Yeah, it is actually number 3.
Okay. It's on demand. Number 3.
Yeah. So,
Please.
doctor who explains diagnosis and treatment in simple language.
Yes.
So, the patients come to the doctor with a complaint and they expect the doctor to diagnose, give a complete corrected diagnosis and treatment. So, when we get the complaints, we should be in a position, the doctor should be in a position to diagnosis, like a spot diagnosis. You should be in a position to diagnosis and you come complete conclusion, and will have a treatment plan in hand, so that the confidence of the patient will increase more and more on the doctor.
Exactly. So
number 11, doctor who clarifies doubts in a simple language. So ultimately, the patient after the diagnosis, they may have doubts on the treatment part. They may have doubts. So the doctors must be in a position to clarify the patient's doubt.
Yes.
As far as the diagnosis is concerned and the treatment plan is concerned, so that this will develop the relationship between the patient and doctor, and they'll have more confidence on the doctor, and this will avoid harassment and violence on doctors.
Yes, I think there is that potential in it. I think sometimes they may not be able to express their doubt, but they may be showing through their body language. So we need to be able to read the body language and ask a question so that they are forthcoming. Okay, we have Shreya and we have a couple more on who wants to share.
Yes, so we have one more, Dr. Harish.
And Shreya,
Yeah, Dr. Jumani, I think all the 11 points which you have mentioned are valid for a doctor.
yes,
It's saying one point I favor and other favors I don't. It is like an injustice.
yes,
And I think one empathy part is missing.
yeah,
Doctors should be an empathetic,
yeah.
apart
That's
from
number.
whatever you have said is all correct. I cannot
Yeah.
decide on one number, two number.
No.
Every point holds when we are dealing with the patient.
Let me rephrase my instructions so that other students are also clear. Number one focuses on empathy. No, every point is important. However, because I want to interact with as many people as I can, I'm requesting you to pick the top 2 or 3 for you. Everything is important, of course, everything is important. So that I want to understand and learn from
I
all of
think
you.
I will, in that case, I will take up 7 number because
Oh, excellent.
a doctor has to explain the patient in his language. There are
Yes.
many patients who don't understand. We use big words, big scientific words. If it is made very simple,
Yeah.
some people are not able to even speak good Hindi or good, forget about English. If it is explained to them in their language, if the doctor knows their language, or can be, the doctor has to draw something, show them something, and explain in the very simplest way. So that makes 2-3 extra points for the doctor. Plus, patient gets confidence. Patient builds up, more bonding with the doctor for going further treatment.
Wonderful. Thank you very much. You summarized that beautifully. Shreya,
Hello.
please. Shreya, go ahead, Shreya.
For me, they should be like we have all kinds of patients. Not
Yes.
everybody is educated.
Yeah.
So many people came from remote areas also. So
Uh-huh.
as a doctor, if we are educated, that doesn't mean that we should use our medical language.
Yeah.
So it is very necessary for us that we make our patient understand what is happening with them. It's their fundamental right to know what is going on with them and how does it affect their life.
Yes.
So for me, third is very important. A good doctor is a person who understands his patient and who makes his patient understand very well. So 3 for sure. And 5 is like doctor who involves in the decision making.
Yes.
Because in our country like India, we have so many religious views also. So if the patient is knowing about his disease, what is happening with him, then the next step comes on treatment.
Yeah.
So he should have that right to decide what treatment he is, he's comfortable with, his family is comfortable with. Sometimes there are money issues also. So it should not be like I have decided this treatment is good for you because this is good for my hospital, everything. Yeah, I should not compel the patient. It should be his choice also. It should be mutual. So for me, third and fifth, are the correct answer.
Amazing, Sharon. Now
Thank you
I
so
know
much.
why you kept on raising your hand. Amazing, amazing points. Beautiful.
Thank you so much.
Shreya, Nivedita, 2 more minutes if there is any comments. If not, we'll move on.
Hello.
Let me check.
Yes, somebody wants to have a word. Please
Hello,
go ahead.
Dr. B speaking. Hello.
Yes, go ahead. We can hear you. Go ahead.
I am Dr. B speaking from Kolkata.
Hello.
Namaskar. First of all, happy here. Dasera is all over going in India.
Fantastic.
So in in my experience, there are good points to read in theory, but in clinical practice, the opposite things we doctors do because we never we never. I just talking on the opposite side of table what patients told me. Then they'll interact. Then the discussion will be more practical than theoretical, because these
Yes.
15 points are 15 points we know everybody. First point I am telling, patients sometimes told me, sir, doctor, take 1,500 rupees consultation and give me 1.5 minute. Number one. Number two, before I end my I end my symptom, the prescription is completed.
Yes.
Number three, sometimes we doctors believe that patient has no right to discuss with the doctor.
Yes.
So I believe at that we doctors are always try to save the patient, but I start in a different angle, because here the medical consultation is going on topic, because I think we must also sometimes what the thing is I think another side I want to highlight, that I often in one of the in India, one of the institution where maximum patients are moving on, that is CMC Vellore. I am taking the name in the sense because from Bengal there is a rush. Bengal, and I think there are some parts of India also move there. But
Okay.
I think what I feel sometimes, that we have so many hospitals, we have so many technologies. What the great thing they are doing, that moving the patient are moving to there or
Okay.
the south.
Mhm.
But why I feel that after when the patient comes back and they talk, that the point number one doctor also told that the point number one is very important, that they feel the patient, they connect the patient mentally.
Yes.
The thing is that sometimes attachment with the patient is also important. What the patients want to say before
Yes.
starting, that's the very
Amazing.
important. So I think in Royal College UK, the point is that their patient load India, there is, we also have doctors have the problem. The number of patients are very high, but still in corporate sector, I think they have time to give the patient a little bit time, so to make the 15 point success. Okay.
Wonderful. Wonderful. I'm so jealous of you. You're enjoying the sweets. We don't have sweets here. but that leads on to the part 2 of the game beautifully. People, my
And
request
finally,
is,
finally, one thing I want to add: the degree of a doctor is the different, and try to convince the patient make the patient a fan of a doctor is completely different. It's an art, and that's why I always believe that practice is an art and science.
I'm a big fan of you now, so you have got that capacity. So
And
let's
that
move.
and India, the one of the legendaries have made by Dr. Debi Shetty. Because what I feel that he has proved that practice is an art and science.
Exactly. He's a great man. So if you look at the title of the game, it's awareness of what constitutes the medical consultation, and understanding, like we are doing beautifully. I'm ever so grateful for you and for Medflix for creating the platform and giving me the space. Appraise is understanding what they are, then we need to act. Okay, well done for choosing all the numbers. This is part 2 of the game. I wonder, what skills do you need? Now, the purpose of the part 2 is, now you are not the patient, you are the doctor. That patient is coming to see you. The patient wants you to talk to them in a clear language, show empathy, explore your concerns. So what skills, I wonder, as a doctor, you need to have in it, so that these values come into practice? What skills do you need to have for number 11 to come into action, for number 7 to come into play? Please share your answers in the comments. What skills do you need for number 1 to come into action, for number 7 to come into action, so that we can make that time and space effective for the patient. Harish Jumani. Oh, somebody says throw ego. I've already thrown ego in the dustbin, Swaraj. Well done. Patience with patient. Wonderful. So somebody raised the hand, Swaraj.
Yes, I'll just get them on the stage. Dr. Jumani, you can. Jumani, I'm sorry. Dr. Jumani, you can come back on.
Yeah. For this explanation part, doctor can explain in a very different manner. If the language is not able to understand that patient, suppose we have a South Indian patient who don't speak Hindi nor English, drawing or can call a staff, make them explain what is happening to them there and there, not later on. Later on, some other person can interpret in a very different way.
Excellent.
Our staff, medical staff, whatever we tell them, they can explain it to them, and whatever they are communicating, our staff can tell us what they have understood and what they have not understood.
So
and in the end, I feel every doctor should ask one question: is there any question left to be answered, or is there any doubt left in your mind regarding your disease or regarding your progress of the disease or regarding the treatment what we have both decided together? Any question left unanswered? I think this is another one point which many doctors don't ask, but this is very primarily practiced in Western countries. In the end, they do ask, is there anything else you would like to know from us? That's very important, I feel.
Yeah, it shows that you're open. And 2 points, 2 skills which he highlighted is health literacy, language matters. Number 2, capacity to learn, to ask right questions, open questions. So somebody else, Iona has raised the hand. She was interested in
Yes. Dr. Iona, you can come up on stage. I accepted your request.
Yeah, hi. I hope I'm audible.
You are, Iona.
Yeah, okay. So I want to focus on point number 8. That is, if the patient is expecting the doctor to know that person as a whole, we as clinicians should learn to equip ourselves to not separate the psychology and the physical complaints of a patient. Because right from diagnosis till management, I believe that everything, I mean, our mind affects everything, whether it be the compliance or the rate of recovery or the final outcome of the patient. I mean, I think unfortunately we have never been trained since the undergraduation times to be able to actually look at certain problems or certain issues of the patient from a psychological perspective. So, unless and until we consider the patient as a whole person and stop separating the mind from the body, the progress will be hindered to a very large extent.
Wonderful, Iona. We welcome you into Team Rambo. You found us. We found you through Medflix. That's exactly what we teach. Be curious. This is it. You will be transformed after this session. This is an introduction.
Thank you so much. It's a privilege.
Follow us on our Instagram page. There are lots and lots of tips that help you connect with the patient as a whole. Anybody else is interested in coming on?
Sure.
Thank you, Iona. Stay for a few more minutes.
Yeah, sure.
Currently, there are no requests, but there are a few comments. So, Dr. Pranali Naik, she says a clear head so that we can acknowledge patients' worries. Can't do that when our head is filled with personal thoughts. Secondly, being free from prejudice regarding the patient.
Wonderful. That is a good connection to our next slide. Exactly our point, people. We know all these elements are important. However, we are falling short on how can I put these elements into practice. We heard you. we've read a lot, we are practicing it, we've been teaching it. Mallika will tell you, we have put forward something called I Will campaign for a better healthcare communication. These are the 5 fundamental principles that we focus on. Those are, like Pranali just now mentioned, intentional presence. How can we be intentionally present in the moment, listen to the other person without any interruption? How can we welcome their narration without interrupting them? How can we resist our temptation to speak while they are talking? How can we welcome patients irrespective of their gender, race, religion, and literacy status? Introduction is very important. Introduce by stating your name, role, and purpose. We talk a lot about how important introduction is. Listen to understand rather than to reply. Asking more and more questions, facilitating the dialogue, facilitating the conversation, to listen, to understand not only the patient's problem, like Iona was mentioning just now, understanding the emotion behind the word, understanding meaning behind the word, understanding the person who is not well, so that we can design the best management plan for them. Last but not least, we can't emphasize enough how important language is. Within this 2 language matters, we focus a lot on health literacy, how well we can speak, how well we can adapt our language to the needs of the patient in front of us. So we teach these 5 fundamental principles at greater depth in our interactive small group sessions. We mainly do sessions in very small groups, maximum of 40 for ambassadorship program, which some of the students have been on. We limit those programs to 12 to 20 students because we want to have more interaction, role play, so that they are ready with the skills. And these are the programs which, this is another slide to emphasize, I Will campaign, carefully chosen, 5 fingers, 5 principles. Intentional presence, welcome, introduction, listening to understand, language matters. These are some of the structured small group fun and interactive programs we offer. You can join 6 weeks of ambassadorship program, small group, and where we cover all those topics: listening intelligence, listenability, another word for language matters, emotional competence, how can we assess risk and communicate risk with the patient, how can we reflect on our professional practice and get better each time, how can we learn in small groups by giving each other constructive feedback. So those are interactive sessions. In total, you will be spending 15 to 20 hours in learning those skills. In addition to that, Dr. Srikanth, Dr. Valluri, Dr. Kadiyala, Dr. Vijayshri, and other members of the team bring their expertise to the table. In addition to the sessions on the program, we also focus on human factors, teamwork, leadership, listening thieves, that's my favorite session, and resilience. We all acknowledged how important resilience is. And today we have talked about medical consultation briefly. However, we have 2 sessions completely dedicated to go much deeper into medical consultation through role plays. And last but not least, assertiveness in healthcare. How can we listen to each other when working together? So those are some of the programs which we offer. We are hoping to work with Medflix and bring those programs to you on this platform. So watch out for further announcements. Thank you for listening and participating. I enjoyed having a dialogue with you. Again, let me summarize. Today, we have a brief discussion on medical consultation. We have introduced the topic to you by playing an interactive game. You've understood what are different elements of medical consultation and what skills are needed. This is an introduction, and we have highlighted the I Will campaign, which we have started to help people like you to enhance your clinical communication. And can you go back to the slide once more? So I encourage all of you to follow our Instagram page at Local Academy UK on Instagram. It's a purely educational page where we post lots of educational tips on how to consult with patients, how to listen, and so forth. That's our Instagram handle, and that's our website. Nivedita, I would like to open the floor for any questions about the programs, or if they want to help us understand how best we can design programs on Medflix, we can open the floor.
Y'all heard Dr. Krishna. The floor is open. Come up on stage and y'all can give him the feedback how y'all would like to take this session forward and ask him questions. There are, y'all.
Harish.
We have, yes.
Before people may be signing off, before you do that, me and Dr. Srikanth, I'm sure Medflix, we would like to say a heartfelt thank you for joining us at this late hour. I know it's late in India. Amazing. We enjoyed having a dialogue with you, and we loved reading those comments as well. Brilliant.
Thank you. Dr. Harish, you can actually raise your hands again and I will accept your request. Till then, if anybody else has any questions that they would like to ask, please come on stage. And Dr. Juman, you can turn your audio on. And
Actually, I joined a little late, I'm sorry. But from what I learned, and I feel interaction of this type is good, but with some practical examples. Nowadays, when we have our academic sessions, always we have some case-based studies. Simulations helps us a lot. It helps exactly what we want to imply. So through the case base, it will help us. Artificial case base, not necessarily a genuine.
Yes.
It will go a long way, because seeing is believing. Photographic memory remains for long, I believe. What you see actually, that remains for a longer period. I according to me, this is one observation I would like to.
Wonderful. And that's precisely what we do in those programs. We do it in very small groups, so there's lots of role plays and interaction through simulated cases, and we design those sessions.
Good evening, sir and ma'am. I'm a medical student, and hello.
Hello, Fazlin. Go ahead.
Yes, sir. So I'm a medical student, and last year in 2020, my mother had a disease, like she had tuberculosis, right? So we went to the doctor, and he had this private clinic, and of course, at that time, I didn't know much about internal medicine and the management, the treatment that we have, and everything relating to it. So we were discussing in this thing, and he was not so much into the complaints or anything like that. He didn't even tell us about the diagnosis. What is the actual diagnosis? We came to know about it after I went thorough with the reports after 2 months. So, and whenever I asked about it, what is the diagnosis and why are you getting the CT done? What do you think it is? So he was always got so irritated, and he was like, I am the doctor. You don't need to ask it, and I am getting the CT done so that I can get to the point. I can understand what is the disease. So I was asking, what do you think what is your predictable diagnosis? What do you think if it is serious or not? So this is, ma'am, I think, answer. I think this should be medical student
Yes.
that we should consider it. That we need to tell the patient about his diagnosis and everything, explain to him everything.
You're spot on,
Yeah.
Tasmin. I hope your mom is well now. I'm sorry that
Yeah,
you
yeah.
had to
So
face.
she's well now and she has completely recovered and with the proper diagnosis and treatment and everything. So I'm glad.
Let me put this, Tasmin. When you qualify, when you start practicing, none of your patients will face what you faced because you know how it feels. Yeah?
Yes, sir.
Yes. So look out for announcements by Dr. Navedita and their team. Join. The more you join, the more you can learn on how to create those atmospheres. Okay?
Thank you, sir.
Yeah.
Thank you very much.
Thank you.
Iona.
I think
What's the
that was
time?
an
Dr. Iona.
unfortunate turn. I'll just want to comment on that. It was a really unfortunate, but I don't think so. Such things happens in Mumbai. At least everybody knows the diagnosis. They are told we are looking for these are the differential diagnosis. This is unfortunate happened to her, but I think it is not very common.
Yes.
It is very rare.
True. I think, yes. Thank you. Iona.
Okay, hello again, sir. Sir, this session has really been very educative. I think there are not many platforms which introduce the both the students as well as clinicians to such information and skills. But I would just like to add one thing. Every the demographic and the issues of every country and and different regions of the world are very varied, especially in our country like ours, the doctor patient ratio is very skewed.
Yes.
So all the points that you mentioned in one of the slides, those 15 points, they are of course, I mean, they are the ideal ones for if a clinician were to be a perfect doctor. However, when the patient load is so high as in our nation, and when time restraints are so prevalent, then I think we need to come up with certain innovative measures with which we can cater to the requirements of different geopolitical regions. So it would be really helpful if you could sort of come up with a session pertaining to that.
Not come up, Iona. We already came up with. We are teaching them. So this is it.
Okay,
Yeah,
okay.
please come and join us. Follow us on our Instagram and look out for this. This is introduction. This is we coming to you saying
All
that
right.
we are offering these sessions. We've been doing this since 2015 and more so virtually since last year. You'll see, Iona, this is, I'm not really said follow on Instagram many times, but come and check out. You can learn yourself. Reach out to us on Instagram. We'll take you through the interactive sessions which we do. And I think you should thank
for sure.
Medflix for finding us, for bringing close to you.
They're doing an amazing job.
Yes.
Absolutely.
Amazing. Iris Chowdhury.
Sir, one more thing, last, Dr. Jumani. Sir, you have
Yeah.
not touched the main thing, the finance part.
Let's not go into it. I intentionally don't want to go into it. Let me hear from Iris, and then I'll say about financial part, because right now, when you say financial part about the courses, you mean, yeah?
Courses plus how do we charge our patients?
No,
Moment they
okay. Let's not have the discussion. Stall. Iris Chowdhury.
no. Moment we say something, some people say the doctors, "Arey, aap lootte ho."
Okay, let's not go into it. That's not the purpose.
Okay,
of
sir.
it.
Sorry.
Hello.
Hello, Iris.
Yes, Dr. Iris, go ahead.
Yeah. Hi, good evening to all. Am I audible?
Clear.
Yeah, thank you so much to Team Medflix for keeping on sending the wonderful invitations. I gain a lot of knowledge, and I want to tell this to all the people who are listening. There has been a lot of ushering of both practical and theoretical knowledge to keep us going amidst COVID pandemic and in future. So thanks for the wonderful sessions. With your kind permission, I would like to add a point.
Please.
To make a comprehensive clinical care, as I have mentioned in the comments, doctors should have communication skills, patience, empathy, understanding, clear head. I mean, all that is definitely mandatory. But what I feel is they should also focus a little bit on preventive medicine at the end of the treatment. Because it's not just about, receiving the complaints, getting to a diagnosis, getting the investigations, putting a treatment for so on, but afterwards also it's a follow-up rehabilitation, and also I think the preventive medicine makes the care comprehensive and foolproof. And today only I was discussing about one of my very close person, a very young person who's suffering from Hodgkin's and is undergoing treatment in Tata Memorial in Mumbai. So I mean, they have it. I was asking whether they have focused also on, after the radiation is over, how to prevent the recurrence. Is there any chance of recurrence, and what is the probability we can prevent? I mean, not for cancer, for any disease. There should be a focus on preventive medicine also. This is just my small addition.
No, Iris, it's not small. It's very important addition, and focusing on well-being is very important. As they say, Iris, we are having a dialogue. What do they say in Hindi? Baat to karo, We are at least having the dialogue. When we continue to have this dialogue again and again on multiple platforms with multiple audience, we all come together. When we come together, we can actually change the culture. Wonderful. Keep coming back.
I keep on coming back. I get all the invites, and to be very honest, the team is really very diligent. I mean, they don't forget to keep on sending reminders, emails, but even if I forget, they don't let me forget that there is a class today. I mean, I really take it very seriously. So hats off and congrats, and keep it going. God bless you. Take care.
I'm so jealous of your comments, Iris. You only thanked Medflix. You didn't thank Local Academy. No,
okay. I mean, Medflix means you also, Nivedita also, all the wonderful hosts you have.
No, I'm just pulling a leg. Okay, Iris, it's late, right?
Okay. Yeah.
Manjeet Singh Arora.
Hi, Dr. Manjeet. I've accepted your request. Please come on stage.
Hello, can you hear me, ma'am?
Loud and clear.
Yes.
Thank you so much, sir. It was a lovely learning session with all the smiles. First of all, I have seen very few speakers and the faculties who have really made an eye-to-eye connect and given a lovely smile to the participants, because I myself am a national trainer on the clinical aspect of the doctors with the students, and therefore I have mentioned if doctors diagnose well and reassure the patient to reach the relatives as well. Money is not important. More than the curative part, let's add palliative factor, and then all is well. Hope all agree here, and then no patient will dare to speak Dr. Lutta hai. The problem is with us. We are not confident. I'm sorry to say this is my because I have been practicing for the past 36 years now and trying to build only one thing, and that is the connect with the family. As just the previous speaker, ma'am, has said that there should be some preventive medicine. This preventive medicine is nothing but a palliative touch to the patient, and I think, sir, you will agree to this.
No, it's and. Thank you. We're not using either or, we are using and. We need everything. Yeah.
So nice. So nice.
I'm glad you noticed much.
It's really a thrill to attend this session. Really. Yeah, it's a thrill.
Wonderful. We keep seeing you more, Manjeet. Okay, what's the time?
It's 10:04 here.
Okay, so well done. We did well with time.
Yes, we did.
Any
sure
further
everybody
questions?
enjoyed the session. I don't see any questions here. Last call to anybody who wants to come on stage and put in their views, have any questions, any feedback for the session, anything you would like to hear on, please feel free to come on stage. And well, I'll take the time to thank you, sir. It was an amazing session. Didn't feel like it was at 9 o'clock at night and then we went all the way up to 10. It was a very lively session. And we have a lot of positive feedback that we've got through the comments. I will make sure to send it to you and Dr. Shrikant as well. We hope to have you back on our stage. And yes, sir.
Yeah, we might buy some space. If you do real estate, we want to invest on Medflix. It's an amazing platform. You're connecting well. Let's keep it going. I think today, I repeat, today is an introduction session to show you, to highlight you who we are. Come forward and say this is we exist. We've been teaching it. We've got some expertise. However, we do need your help, your support in making our concepts adaptable to Indian culture. Hence, our vision is, although we want to make people globally competent, we want to focus on how can we make them locally responsive. Yes, we got some expertise into these complex concepts. However, we want to work with you in bringing the best so that we can all have happy lives, including patients. We are patients. We want the same from doctors. Okay. So amazing. So wonderful audience. I've enjoyed interacting with you. Thank you again. Good night.
Thank you so much. A very good night to everyone.